Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we will look at the subject strategy for prosthodontics. Now, Prostho covers a lot of topics with regards to complete dentures, fixed partial, removable partial, maxillofacial, implants being parallel to perio. But overall, you will see a lot of common questions between Prostho and dental materials. An implant is shared by oral surgery, perio and Prostho. So here, the strategy is very simple. You need to focus on very important questions. There has been a lot of trend with regards to the questions in Prostho. Now, when we look at previous year's trend, there has been more or less an average of 14 questions which is designated to Prostho, and like I said, you will see a lot of these questions appearing in dental materials as well. Now, a lot of students fear Prostho because they think it is technically very difficult to understand. But remember that FPD has very limited content and is very easy to grasp. Partial dentures, once you watch the videos, is very easy to understand. It's more conceptual. And when it comes to complete dentures, the curriculum may look very vast, but the kind of questions that they ask are very repetitive. So keep an eye on the questions. Here we are going to allocate all of these questions to the specific topics on the left side. And then we will see what kind of strategy to follow. So first question, starting with NEET 2023 on ovate pontic. It is indicated in recently extracted sockets. Which of the following structures is not attached to modulus zygomaticus minor? Mesenteric notch is the action of masseter on buccinator. Advantage of giving a subgingival finish line, that is a question on finish lines and margins. An edentulous patient was given a denture with anterior and posterior palatal strap. Where should be the posterior palatal strap be placed? This is major connector. Edentulous patient after receiving the denture found it tight initially, but after some time it becomes loose. This is because of an impression error. Now you will find a lot of questions on post-insertion problems with regards to complete dentures, and all of these errors will be at different positions in your understanding. So some errors start because of problems with impression, some errors are because of problems with jaw relation, some problems because of occlusion, and some problems because of post-maintenance, post-insertion. So you have to categorically understand all the different strategies with regards to post-insertion problems. They are very important questions and almost always seen in NEET exams. Next question, ideal length of a bar attachment, factual question on implants. Then we have a pyre abutment and where is the position of key and keyway? This is a very important question. It has appeared twice in exams. You can go through the explanation. Make sure you look at the explanations thoroughly. Take down notes in your notebook or workbook. And you can also watch the explanatory video. The explanatory video will give you good illustrations and it will also talk about the different strategies to eliminate options. So make sure that wherever there is a video attached, you go through that video. Next question is advantage of a screw retain prosthesis. This is on implant. It can accommodate smaller or lesser interocclusal space. Which of the following is favorable for long posterior cantilever, tapered arch form? Loss of vertical dimension in a completely edentulous patient causes what type of changes in the mandible? Residual ridge resorption. You will find that under extra cover and special techniques. The next question is distrobuccal flange of mandible is shaped by. This is similar to mesenteric notch question that we saw earlier. So action of masseter on buccinator. Here is the discussion. Bilateral antero-posterior resection as classified by Aramani. This is maxillofacial. Remember the Aramani classification. What is the purpose of an implant analog? It is to replicate implant in the cast. Impression material of choice for flabby ridge is addition silicone. Now you must know how to eliminate other options. You will find that a lot of options will be identical and they will be relevant. So watch explanatory videos. Most common cause of failure of implant retained prosthesis is screw loosening. Then an image based question of Maryland bridge. Contraindication of this is deep bite. Patient has undergone an extraction of the maxillary central incisor and wants a replacement ovate pontic. This is similar to the first question that we saw. In case of unilateral distal extension, that is class 2, where will you place the indirect retainer? It is always away from the fulcrum line. Ante's law is related to the pericemental area of replaced and missing teeth. So let's put that under principles of tooth preparation. A female patient has missing left lateral incisor, canine and first premolar. What is the treatment plan? Double processing method is used for curing dentures. Then an OPG showing impression copings attached to implants. Then another image based question of Gothic arch tracing in centric jaw relation. A dentist prepared a maxillary molar to receive a full coverage cast crown. He placed palatal cusp. Functional cusp bevel, important question. It keeps coming multiple times. Another question on functional cusp bevel, the angle is 45 degrees. Following tooth preparation, which chemicals are suitable for gingival retraction? Acidic, right? Here is the pH of all the different gingival retraction materials and chemicals. Also, there is a video explanation attached. A patient had to undergo enucleation of the eye ball and its contents due to trauma. Following the surgery, the volume of socket appears shrunken and the patient is seeking prosthetic treatment. What type of implant? Semi-buried integrated. This is a maxillofacial question. Patient was rehabilitated with an extraoral prosthesis. This is based on material and the disadvantages. Discoloration, worn edges. This is all polyurethane. Why are maxillary posterior teeth placed buccally to alveolar ridge in complete denture? This is to reduce the ridge resorption. Pre-extraction records for VD. So that's a question on vertical dimension. I hope you are following all the topics on the left side. So whenever I'm assigning a question, it will start blinking and you will identify which topics are relevant. Identify the incorrect statement about finish line. Under preparation leads to lipping. Patient has opted for a maxillofacial prosthesis, is happy with the outcome. On subsequent use, there is instability of color. This is PVC. A person with implant supported auricular prosthesis complains of lack of hygiene. In a newborn patient with cleft lip and palate, impression is made with monophase. You can find more questions on cleft lip palate in embryo, in ortho and in surgery. All are the functions of interim prosthesis except, and the answer is conditioning of remaining teeth and ridge health. What is the function of provisional prosthesis? Simple. High water prosthesis is another name for sanitary pontic. Another question on Aramani classification, class 4. They've shown the obturator design here. Next question. Ideal interarch space for removable implant prosthesis is approximately 12 to 15 millimeters. The type of prosthesis shown in image given below is cantilever bridge, types of FPD. A question on mandibular movements. Important. Here is the explanation. Make sure you watch the videos on mandibular movements because a lot of students feel that this is a difficult topic. You can find the videos under tasks and bytes. In non-rigid connector, the correct statement regarding the position of its components. This is a repeat question. Earlier we had an image attached, right? So female pyre abutment, male distal pontic. The function of occlusal bevel, again a repeat question, is structural durability. In Kennedy's class 3, where should be the position of the occlusal rest? In the interproximal area. When an RPD is planned for missing first and second molars, when should the occlusal rest seat be prepared? It should be after proximal guide plane. Then identification of a speech aid appliance, image based question, maxillofacial. Distance between major connector and gingival margin in maxillary arch should be 6 millimeters. Repeat question on Ante's law, it is regarding abutment. Then another question on implant, this is a torque wrench. You will also find a similar question in perio. Indications of porcelain veneers except teeth shortened due to bruxism. Maxillofacial, again, velopharyngeal incompetence is treated by palatal lift prosthesis. Then recording the PPS has to be done at 30 degrees. Not an example of a sibilant sound is N. F and V are types of labiodental sounds. So all of these are under speech in complete dentures, and we'll categorize that as special techniques in CD. Finish line used on the buccal supragingival margin for a PFM crown is shoulder with bevel for maxillary first molar. Kennedy's class 4 identification, straightforward question. Alright, so it's allocated to Kennedy's classification on the left side. Shape of cingulum rest in a cast partial denture is inverted V. The angulation of occlusal rest C to the minor connector from which it originates is less than 90 degrees. Then the internal finish line in the framework is obtained by adapting relief wax along the alveolar ridge. Then amount of encirclement should be minimum of 180 degrees. Then RPI provides push type retention, direct retainers. Principal problem faced when a mandibular complete denture opposes natural dentition, difficulty in achieving balanced occlusion. Also read about combination syndrome. Maxillary denture is retained by thin film of saliva between tissue and the denture. This is called interfacial tension from impressions. Purpose of transparent acrylic template in case of immediate denture is to be able to get a better visualization of the bony margins. Then interim obturator is planned in case of a maxillary surgery. It is given 2 to 4 weeks after the surgery. Maxillofacial prosthesis. Maximum broad coverage area of denture bearing areas provide snowshoe effect. Joint between major and minor connector is a butt joint. Okay, so that goes to minor connectors. Major drawback of metal denture base is difficulty to reline because it is in direct contact with the tissues. Purpose of transparent acrylic template repeat question is to trim the jagged bony margins. Characteristics of a broad PPS, shallow palate with less muscle attachment. Deep chamfer is also known as hollow ground bevel, so finish lines. Finish line for acrylic jacket crown is shoulder, radial shoulder. Type of joint between major and minor connector, repeat question, butt joint. Then image based question for identification of modified ridge lap pontic. And most common cause of over-contoured crown is under preparation. Similar question with different language before. So that brings us to the end of the analysis, and as you can see, we have 17 questions from maxillofacial and implant. Who would have known? This is one of the topics that are really upcoming. You will see a lot of questions coming up in all INI-CET AIMS exams also. So do not neglect maxillofacial and implant prosthesis. It is not much to cover. It is all basics only. Watch videos, look at all the data that's there. Cover implants in perio and prostho both. The surgical aspect is covered in perio. The prosthetic aspect is in prostho. So make sure that you are well versed with implants and maxillofacial restorations prosthesis. Then as you look forward, special considerations in complete denture and principles of tooth preparation are most important, and less important are very factual questions. Here you see a lot of clinical questions, a lot of relevant case-based questions with images. So make sure your focus areas is divided amongst all the topics equally, because you can expect a mix of everything in the exam. Now, like I said before, there's a lot of dental material overlap with prostho too. So make sure that you are also looking at dental material as an integrated subject with prostho. Now, how do you prepare these topics? So you have all the necessary tasks attached to these topics here. So this is complete denture. Likewise, you have fixed partial denture and removable partial denture. You can start preparing by clicking on prepare, and then you will have access to all these videos and notes and synopsis. Simultaneously, you can also have workbook videos. So if you look at vertical jaw relation, for example, you will first go through the notes, right? And then you will make a note of all of this in your workbook. Whatever new questions you come across, any difficult questions from that topic, make a note of that in the workbook and prepare. Watch the video attached to all of these topics, right? Now, once your preparation is complete, once you finish your preparation, then the next step is to practice questions, so that you can practice from here. You can see practice questions. And once your questions are practiced and once you have enough understanding of the subject, then take the test. Now, while taking the test, again, don't forget to review the explanations and the key concepts and make a note of that in your books. Now, do that for CD, for implants and maxillofacial, for FPD, RPD, and then take the Q-Bank. Q-Bank will have a lot of integrated questions and you will get a good hands-on experience of the entire subject. And now I will tell you how to maximize your preparation with Meritor's app. Now, there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic, and then practice questions. And then you can take the test. Now, whenever you are taking a test or practicing questions, each question comes with the answer, explanation and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q-Bank. Now, Q-Bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics. They are clubbed together chapter wise and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations and key concepts. So once your tasks and Q-Bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now, the tests are of 2 types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week, you will have a test which is going to focus on that specific subject plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, you will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan-India or all-India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks because it gives you a good hands-on experience of the exam. It gives you an idea of time management because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now, apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meriters.